Hello everyone, this is Fermin Gomez from Mexican Institute of Social Security in Monterrey, Mexico. Today I'd like to talk about an interesting case series published in Archives of Plastic Surgery titled Analysis of Digital Ischemic Necrosis from Constrictive Finger Dressings, a case series. In this article, Lee and colleagues draw attention to a rare but highly preventable cause of severe hand morbidity, and this is digital ischemic necrosis secondary to circumferential finger compression. While this mechanism is well recognized in isolated case reports, there is no comprehensive case series, particularly those that compare iatrogenic and caregiver-related injuries. The purpose of the study is to analyze the clinical characteristics, severity, management, and outcomes of patients who develop digital ischemic necrosis due to constrictive finger dressings, with a particular focus on identifying patterns that could inform prevention and early recognition. This case series includes 9 patients treated over a 10-year period, from 2014 to 2024. 7 cases were iatrogenic, most commonly associated with self-adherent compression dressings such as Coban, while 2 cases were caregiver-induced, involving everyday objects like rubber bands or hair ties. Pediatric patients accounted for the majority of cases, highlighting a vulnerable populations. In result, a clear distinction emerged between the two groups. Iatrogenic cases tended to present earlier, with a mean delay of 5.5 days, and they were often managed conservatively or with skin grafting. In contrast, caregiver-induced injuries presented later with more extensive tissue loss, frequently requiring free-flap reconstruction. In cases involving bone exposure, long-term sequelae such as digital shortening and sensory deficits were observed. The discussion provides an important pathophysiological context, emphasizing how a small digital diameter, limited collateral circulation, and uneven pressure distribution dramatically increase ischemic risk, particularly in children. The authors also highlight how commonly used materials, despite being considered safe, can generate pressures sufficient to cause ischemia when applied circumferentially and left unchecked. Now, what are the clinical implications? Perhaps the strongest contribution of this paper lies in its preventive message. The authors stress the importance of exposing fingertips for circulation monitoring, ensuring frequent reassessment, and educating both healthcare providers and caregivers on early warning signs such as color change, pain, and sensory loss. In summary, this case series reinforces that digital ischemic necrosis from constrictive dressings is a serious yet avoidable complication. Through heightened awareness, proper dressing techniques, and timely recognition, many of these injuries and the need for complex reconstruction can be prevented. Thanks for watching, and remember to subscribe to our social media.